Yeah. All right, we're just going to do a little oxygen check. It's probably not in the paramedic assessment, but just go through it anyway. So we go through some of the components. So we have, first thing we generally do is make sure we've got oxygen. So we take this apart here. We've got various masks and things here. Okay, so we turn on the oxygen. Okay, and we can see that it's up on the green needle. So we have sufficient oxygen, so that's okay. There's no leak. It's seated quite okay. That's fine. There's no leakage. That's excellent. We can now turn that off. Okay. This little device here is attached to a suction device. So we have a little sucker here, which again is attached to little suction outlet there, and we can put a Yanker sucker we can put in there as well, and we've got suction. And how we apply that suction is by turning this on here.
You need a stretcher down here as well?
Nah, don't need that.
No, all good.
No. I'm pressing this little button here.
Strong young lads as well.
Okay, so we tested the suction. The suction works okay. I can feel that on my finger. Okay. Now we switch that off again to make sure we're not wasting oxygen, because this uses a fair bit of oxygen. That's on okay. What I tend to do is I tend to loosen this, because essentially suction is probably the last thing that we're going to need. We're going to be, you can't use the oxygen flow meter, or the flow meter is actually an integral part of this, so you can dial this up to whatever flow you like, up to it goes up to a maximum of 25 litres. Okay, but generally with the mask and so forth, we're looking at 8 to 10 litres a minute. So we can dial up our oxygen flow there. However, we need to disconnect this before that'll work. So we need to disconnect that. So I just tend to loosen that a little bit, so it's ready to disconnect. Pop that back in here. All right, got sufficient oxygen. It's seated okay. There's no leakage. We look at other components that they have in here. We've got various masks. So we've got some nasal cannulas there. We have a plain oxygen mask here, adult one. We have an adult nebulizer mask here for salbutamol. And we also have a paediatric mask is here as well. And on the other side, again, we've got a non-rebreather adult mask. We have a laryngoscope. So this has already got a battery in it. We just have to engage the blade, and that should automatically function. We also have here when we're talking about, remember we're talking about the eye gels?
Yep.
Okay, so this is a either a nasal or oro catheter, and we can insert that either down through the nose, or through the mouth, or through that little hole that's in the eye gel. Okay, we insert that down into the stomach, and we can then use this 50ml syringe, which has got a special little lure lock on it. Okay, so that'll fit in on the end of the nasopharyngeal catheter. That'll sit on the end of that, and we can sort of suck stomach contents out, or air. It just fits into there. That's it. Also a fairly useful device. We use that routinely whenever we have an unconscious patient, to reduce the risk of gastric regurgitation. Okay. The way we measure this is ear, okay, nose to Ziffy. Okay. We put a little tape on that,
Yep.
and when we insert that either through the nose or through the mouth, up to the tape mark roughly should sit nicely within the stomach. Okay, over here we've got our BVM, so we make sure that that's functioning okay. So we pull that apart, we put the bag onto the end, and we'll put the mask on and make sure that there's no leaks in the mask, that it's seated nicely, so that's got a nice cushioning effect. Okay, and then we can sort of just test that it's functioning okay. In this component, we were talking earlier about the CO2, the end-tidal CO2 port with a little adapter. We can put that adapter into here and into here as well, so I can measure end-tidal CO2 when we're ventilating a patient. Alright, just some extra tubing if we need to connect that to our masks. We also have our eye gels in here, so we've got a 3, 4 and 5, so we've got the 3 sizes that are here. We have our, this is a little adapter, this is a filter, okay, essentially what we do, the filter goes, attaches onto here. We don't need it because this is disposable, okay. So where we have ventilating machines, or we have a, we have a mechanical ventilator, expensive machine that you're going to use over and over again. We attach a filter between them for these sort of things. We really don't need it. These are disposable, so we're not going to use it for another patient, so not really essential to use. We have a few nasopharyngeal airways as well, so several sizes there as well. 6 and a 7, and McGill's forceps, which is good for removing any foreign body airway obstruction. And again, we've got the Yanker sucker, which we attach to the end of our suction device here. And a range of oropharyngeal airways in here. And again, another end-tidal CO2 with this one's got that adapter that I was explaining about before for measuring end-tidal CO2. So everything's here. We've got the lubricating gel also nicely taped to the eye gels as well. Okay, the water-soluble lubricating gel. Excellent. So everything is in order. Okay, thank you.